Hello, my name is Jordan Stamman, and this is for HUM 501, Trends in Therapeutic Nutrition. We're going to talk about nutrition-focused physical exam today. Nutrition-focused physical exam is a valuable tool for dietitians to have objective data points to diagnose malnutrition in their patients. So today I'm going to demonstrate what a nutrition-focused physical exam is. So first you want to introduce yourself to your patient and explain what you're going to go through today. So I'm going to go through a nutrition-focused physical exam. I will be feeling throughout your body to show muscle or fat loss, as well as just general edema or muscle wasting or anything like that. So first you want to look at their general appearance. You will notice that in a healthy patient they will be alert, oriented. You'll be able to speak with them. They won't look tired or fatigued. You won't notice any wasting. In a malnourished patient, you will notice that they're tired, fatigued, have muscle wasting, fat loss. Next, you'll move to their hair. You'll notice in a healthy patient, they will have full, nourished hair. In a malnourished patient, you will notice that their hair is dry and brittle. Then you'll move to their temporal region. Temporal region is to the sides of their eyes. You'll be able to see an indentation as well as you'll be able to feel an indentation in a malnourished patient. So you want to see the muscle, you want to feel the muscle to prove that they're nourished, but in a malnourished patient you will notice that there's an indentation and there's muscle loss. Then next you will look at the patient's eyes. You will notice that there is yellowing or jaundice in a malnourished patient, so look for the yellowness in the eyes. And then you'll ask the patient to close their eyes, and then you'll feel the orbital bone region. So you should feel fat pads here, and if you feel the fat pads, you'll notice that it will bounce back. So it will bounce back once you release. In a malnourished patient, you will notice that there are not fat pads there, so you'll just feel the bone, and you'll be able to see an exposed bone, and you'll notice that the eyes are sunken. They look sunken, and then you'll notice the dark rings underneath the eyes. Then you'll move to the patient's mouth. You'll ask the patient to open their mouth. You'll check the lips. The lips will be dry and scaly if the patient is malnourished. And then you'll check the teeth, make sure that they have all of their teeth or dentures so that they can eat. And then you'll check the tongue and gums. In a malnourished patient, the tongue and the gums will be swollen and red or even the scarlet color. Then you'll move to the patient's cheekbones. Should be able to feel the muscle here, and you'll be able to feel or see if the patient is malnourished. In a malnourished patient, the cheekbones will be much more prominent, and you'll notice that there are not muscles. You'll feel that there are not muscles in the cheekbone area. Then you'll feel underneath the chin. Should be able to feel the muscle here as well. In a nourished patient, in a malnourished patient, you will notice that you will not be able to feel the muscle underneath the chin bone. Then you'll move to the shoulders. This is where you'll check the clavicle or the collarbone. You'll feel behind the collarbone for muscle. In a malnourished patient, you will notice that there is not muscle behind the collarbone region. So then you'll feel out to the shoulder. And then you'll go to the deltoid or shoulder region. You'll be able to feel the muscle here, and you'll notice that it is rounded in a nourished patient. In a malnourished patient, you will notice that the shoulders are square, or that the deltoid bone will be pointy. So you don't want to see pointy or square shoulders. You want to be able to see the rounded shoulders to see that there is muscle there. Then you'll move down the patient's arm. You want to feel the skin. You'll notice that in a nourished patient, the skin is, you can notice that they are hydrated and it's not dry. So in a malnourished patient, the skin will be dry and it won't have turgor. So this is where you'll check the skin, make sure that it returns back. In a malnourished patient, the skin will be loose and it will not have the turgor, so it won't have that skin integrity. And you'll feel down the arm, and this is where you'll go to the interosseous region, or in between the fingers. You will notice and feel the muscles here. In a malnourished patient, you'll see the indentation in between the bones, and you won't be able to feel the muscle here. And then you want to ask their patient to make an OK sign, and then you'll feel in between the thumb and finger. In a malnourished patient, you won't be able to feel the muscle here, so it'll be indented in between the thumb and finger. And then you'll check the patient's fingernails. In a malnourished patient, you will notice that the fingernails are brittle and they're lacking their color, and there's concavity on the fingernails. So you want to make sure that you're checking the fingernails as well. And then you'll ask your patient to raise their arm, and then you'll check the tricep skin fold. You'll notice in a malnourished patient there will be fat loss underneath the tricep muscle. So you don't want to grab the muscle, you want to grab the skin underneath the muscle to feel the fat. Then you'll move to the back. So you'll ask your patient to move, and then you'll check the scapular region or the shoulder blade. So here you want to be able to feel the muscle here. In a malnourished patient, you will notice that the shoulder blade is exposed, and you'll be able to feel the shoulder blade here. And then you will check for spine. If the patient is malnourished, you'll notice that the spine is exposed. And then you'll check the latimus dorsi underneath the shoulder blade. You'll feel this muscle here. In a malnourished patient, you'll be able to feel the rib cage exposed, the indentation, so you want to feel the scapula. And another data point you want to look for in a malnourished patient is edema. And there are two places that are edema are common, and there's one place for ascites. These are different kinds of fluid accumulation. So you'll check the sacral region, which is the lower back, for fluid or edema. And you'll check the ankles, which I'll get to later, and then you'll check the abdomen or peritoneal cavity for ascites. So you'll check the sacrum or the sacral region for edema. Then you will check the iliac crest or the hip bone. In a malnourished patient, you will notice that you can feel the hip bone protruding. So you'll check the hip bone. And then you will ask the patient to move back. And then you will check their legs. So have her hold this here. So you will check their legs. So you'll start with the quad and the thigh region. So you'll feel in a malnourished patient the legs will thin towards the kneecap, and then you'll want to check for muscle in the quad region. And then you'll check the patellar region or the kneecap. You should be able to feel the muscle around the kneecap. In a malnourished patient, you will notice that the bones are much more prominent and exposed. And you should also check the abdomen for ascites. So the fluid accumulation in the peritoneal cavity is a sign of malnutrition. And then you'll go to the gastrocnemius or the calf region. You should be able to feel the muscle here. Should not be able to feel the bones exposed. In a malnourished patient, you will notice muscle wasting, and you notice that the bones are more exposed. Then you'll go to the ankle. This is another place for edema. So you should not be able to see fluid accumulation or feel fluid accumulation in the ankle. That is another sign of malnutrition. And some other objective data points that you can use to assess malnutrition is handgrip dynamometry or grip strength. So you'll need a baseline from where they're healthy. So if their hand grip strength number is lower than their baseline, that is another sign of malnutrition. And also weight loss. In a malnourished patient, they will have weight loss of 5% in 1 month, 7.5% in 3 months, or 10% in 6 months. So you'll need a baseline of what their usual body weight is, and if you see greater than 5% of that in a month, 7.5% in 3 months, or 10% in 6 months, that is another objective data point that you can use to assess malnutrition. So this is a comprehensive nutrition-focused physical exam, and these are great objective data points that you can use to diagnose malnutrition in a patient. Thank you.